Hello, so today we're dealing with pulmonary embolism, and we can abbreviate pulmonary embolism like this, PE. And we are dealing with Wells criteria. So you need to connect these two words, pulmonary embolism with Wells criteria, because Wells criteria is very important for dividing the patient into a classification system so we can give treatment for different patients. So for example, we have low, we have intermediate type, and we have high criteria. So we have three types: low, intermediate, and high. And we give a score based on a number of factors. And when we give low score, that's when we have less than 2 points. When we give an intermediate, that's when we have 2 to 6. And when we have more than 6, that's a high score. And the way to remember just two numbers here, 2 and 6. So everything above 6 is high, everything below 2 is low, and everything between is 2 to 6. So what we will do now is to explain what we mean by these scores. So for example, we can give 3 points, we can give 1.5 points, and we can give 1 point for different types of patients. If you, for example, have a deep vein thrombosis, so I will draw a leg here, we have a vein here, and we have thrombosis of the leg, deep vein thrombosis of the leg, which means that the legs are getting swelled, and we have it's very painful when I compress the leg. So when I compress the leg, it's very painful. These patients that have current, I will write current here, current. If he has deep vein thrombosis at the moment, I will give him 3 points, which means that we are not in the low category anymore. We are in the intermediate because he has already 3 points between 2 and 6. If he has previously had a deep vein thrombosis, then I give him 1.5 points. So that's the difference here. You can see 3 points for current deep vein thrombosis, 1.5 point for previous. I will write previous. Previous deep vein thrombosis, and I give it 1.5. So if I give you 1.5, I'm still at the low region. And in order for you to appreciate this low, intermediate, and high, I need to explain why this is important. If you have low probability, this is probability. If you have low probability of pulmonary embolism, then we need to do something called PERC. PERC stands for an exclusion criteria, pulmonary embolism exclusion criteria, which means that if the probability clinically is low, then we do another criteria, which is consisting of 8 criteria. I will deal with that in another video. If this criteria tells me that, yeah, this patient has pulmonary embolism, then I continue with D-dimer test. This is a lab test, so this is not expensive. The PERC is only a criteria. I just need information from the patient, 8 pieces of factors. And if this tells me that he has pulmonary embolism, then I need a lab. Because I need a D-dimer value in the blood. So I take a blood sample and I send it to the lab, and I get the D-dimer value. If this D-dimer value is more than 500 nanogram per milliliter, more than 500 nanogram per milliliter, then I know that this is one other factor of pulmonary embolism. So I had low, then I had PERC, which showed that this patient has pulmonary embolism. Then I had more than 500 nanogram milliliters. So now we are starting to feel that, yeah, this patient has probably pulmonary embolism. But we need to do a last test, and that's CT angio. CT angio of the pulmonary system. So pulmonary CT angio, pulmonary CT angio. So these are the steps. I'll write an arrow here, and it's very convenient because if he has intermediate score, then I do a D-dimer directly. I don't care about PERC then. PERC, I only do PERC when I have low score. If I have an intermediate score, then I do the D-dimer directly. And the same goes here. If it's more than 500, then I do the CT angio. When I have a high score, I do the CT angio directly. I don't do D-dimer, I don't do PERC. These are not so expensive tests, but I don't need those because I already have a high probability. It's certainly a pulmonary embolism. I just need to confirm it with a CT angio because this is very expensive. You cannot do CT angio for every patient. That would be ridiculous. Okay, a patient comes in with dyspnea. Dyspnea means that you have difficulty breathing. That's one of the most common symptoms of pulmonary embolism. And I cannot just send a difficulty breathing patient to the CT angio directly. I need to do the other tests, which are not so expensive. So, but when you have a high probability, the money does not matter because we have a high probability pulmonary, then we need to quickly find out if this patient has pulmonary embolism to quickly save his life because he can die from this, okay? So, if we continue with this, I check the patient, he currently has deep vein thrombosis. I see the swelling in his leg, he complains of pain when I compress the legs. Then I give him 3 points, which means he's in the intermediate group, immediately, at the point, which means that I do the D-dimer test. But wait, we have other tests. We need to find a score here because this is just one part of the score. I have drawn these things, 1, 2, because 2 things can give you 3 points. 3 things can give you 1.5 point. 2 things can give you 1 point. Okay? 1 was this, deep vein thrombosis, current. Here, one of these 3 can give you 1.5. That's previous deep vein thrombosis. Previous deep vein thrombosis. So one is checked. The other here is when you have more than 100 beats per minute. Heartbeats per minute. So I listen to the heart of the patient and I hear that it's more than 100 beats per minute. Then I give him 1.5 score. So if this patient has deep vein thrombosis and his heart is beating more than 100, then I have 3 plus 1.5, which means I have 4.5. That means I'm still in the intermediate zone, which means I'm still doing the D-dimer test. But we continue. We have another one which can give you 1.5. So we have many things that needs to be considered. And these are the quickest to ask. Because here, 3 points can also be given for patient which I write diff, which means differential diagnosis. So patients which we excluded other diseases, like we checked other heart diseases and lung disease and everything, and we find out that no other disease can really explain this difficulty breathing, then we give this patient 3 points because we excluded all other diseases, which means that pulmonary embolism is more likely here. But in my opinion, I would not start with this because this is very complex. You can have let's say 50 diseases that can cause difficulty breathing. So I would not start to exclude them one by one because pulmonary embolism is so dangerous that the patient can die, and you don't have so much time to exclude all other diseases. So my personal view of this Wells criteria is that don't focus on the differential diagnosis at this point. Focus first on the deep vein thrombosis because this can give you the highest point, 3 points. Then focus on the breathing pattern. So you see that he's breathing more than 100. That gives you 1.5 score also. Then focus on the previous deep vein thrombosis, which also can give you 1.5 point. So these are the things that I would first start with. And the third thing that can give you 1.5 is immobilization, which means that the patient has been, for example, laying down for more than 3 days. I will draw a patient here, and he's lying down in the bed for more than 3 days. More than 3 days. More than 3 days he has been laying down in bed. For example, in a hospital. Patients who are laying down in the hospital too much and they are not walking around in the hospital, they have an increased likelihood of getting pulmonary embolism. That's very dangerous. So patients should walk. Of course, not everybody of the operations and so on, but the general approach is that patients should not be lying down in the bed for too long. or if they had an operation within the 4 weeks. I will write operation. So 4 weeks, within 4 weeks they had an operation. So I will ask the patient quickly when he comes in with difficulty breathing, did you have an operation within these 4 weeks? Or in these 2 weeks, 3 weeks, 4 weeks? Yes, then I give you 1.5 point. Did you lay in bed or did you not move so much in these last 3 days? Then I give you 1.5 point. Did you have a heartbeat which is pumping more than 100 per minute? Yes, then again 1.5 point. If you have all these, then you have 1.5, 1.5, 1.5, which means you have 4.5. Your intermediate group. If we combine that with the current deep vein thrombosis, you have 7.5, then you have high. So which means that if this patient complains of all of these things, then you have more than 6. He has 7.5, which means that we do the CT angio, pulmonary CT angio directly. You see? And the last 2 points can be given for malignancy. So tumors, malignancy, and the other is dyspnea, hemoptysis. Hemoptysis, which means that you are vomiting blood. I will draw a guy here, and he's vomiting blood. Hemoptysis or malignancy. I will just draw a tumor here. So you can remember that. Malignancy, tumor, hemoptysis is vomiting blood. You give each of these 1 point. So that's Wells criteria, and actually you know everything. So just to revise now, just to make this stick into your mind, you get the patient. He's complaining of difficulty breathing because that's one of the most common symptom of pulmonary embolism. What do you do first? Think of Wells criteria, and what do you think of first? Don't start with this. These are the scores. These are the points. Start with these lower ones. You know you can give 3 points, 1.5 point, or 1 point. You start with the most points, for 3 points, and you start with deep vein thrombosis. So what do you do first? Patient with pulmonary embolism suspicion. You suspect him that he has a deep vein thrombosis. You go there, you check his legs, you see that the leg is swelled, you compress the legs. Then, if it's so, then it's high probability of a deep vein thrombosis, which means you give him 3 points. Okay, now we start to count the points. We forget the differential diagnosis stuff here. You can do that, but I will not do it here. I will go on with the quick information first. We check the heartbeat, more than 100 per minute. I give him 1.5 point. I check that, I ask him, did you have a deep vein thrombosis previously in your life, or 5 years ago, or 10 years ago, I don't care. Yes, he had that. I give him 1.5 point once again. I ask him, did you lay down in bed for the last couple of 3 days? No, he said no. Okay. Did you have an operation? Yeah, I had an operation 1 week ago. Okay, I gave him 1.5 point again. I ask him, do you have any tumor known? Is cancer known in your body? Yes, I gave him 1 point. Did you ever vomit blood? He says no. Okay, then I don't give him 1 point because I would do that otherwise. So now you count. 3 point because he has current deep vein thrombosis. Plus, previously he also had that, which means that 3 plus 1.5 is 4.5. Okay? He also had a beating heart of more than 100. I give him 1.5 points again, which means that he has now 6 points. Then he had an operation within 2 weeks. I give him 1.5 points again. Now he has 7.5 points. 7.5%. He said that he had, he know that he has a tumor in his body. Then 1 point, so he has 8.5. Okay, then I give him a point of 8, more than 8.5, and I do CT angio directly. That's the test of choice. And then this CT angio will show now if he has pulmonary embolism or not. If he has that, then we go on with the treatment quickly to save his life. Another patient comes in, and then he says, then I do the same. I always start with this 3 points because that's the highest point. I check his legs, no swelling, no pain, nothing. Okay, we skip that. Then when I go on, I listen to the heart. I hear that it's below 100. So I don't give any points for that. I asked him, did he lay down in the last 3 days? No, he didn't. Did he have any operation within the 4 weeks? No, he didn't. Did he ever had previous deep vein thrombosis? Yes, he says. Okay, I give him 1.5 point. Then I ask him, do you know about any tumor or malignancy in your body? No, he doesn't. Did you vomit any blood in the last days or in the last days? No, he didn't. Okay, so I know that he only had a deep vein thrombosis in the previously. I gave him 1.5. I check my Wells table. I see that it's 1.5 is less than 2, so it's low Wells criteria, which means that I go on with the PERC, which I will discuss in another video. I checked 8 criteria here in the PERC, and all the 8 criteria now shows that yes, it's a probable pulmonary embolism. I go on, I check the D-dimer test, and yes, it shows that it's more than 500 nanogram per milliliter. And then I do the CT angio, and I see that yes, it's a pulmonary embolism. So just because you have a low score of less than 2 does not mean that you don't have pulmonary embolism. That's my point here with this patient. He had a low score. He only had previously deep vein thrombosis. All other stuff was negative here. Okay, but when we checked PERC, when we checked D-dimer, when we checked CT angio, it showed that he had that. If we take another case, let's say he doesn't have anything here. He doesn't have anything here, which means that it's less than 2. But just because he doesn't have anything here does not mean that he don't have pulmonary embolism, because now we have less than 2, then we do the PERC. PERC shows that it's pulmonary embolism, D-dimer shows that it's pulmonary embolism, CT angio shows that it's pulmonary embolism. Okay? Or we take another case. We have all this stuff are here. We have current deep vein thrombosis. He had it previously, operation within 4 weeks. He had more than 100 beats per minute. He had a tumor, and he had been vomiting blood. So we have more than 6 points. And now you think, oh, this guy really has pulmonary embolism. No, he didn't, because when we checked the CT angio, pulmonary CT angio, it showed that there's no pulmonary embolism. So you see, this score is important. Why? Because of the algorithm, not because it shows that you certainly have pulmonary embolism or not. Okay, so this is my main message here. That, for example, the algorithm just makes you go in the right direction. So when you had a positive D-dimer test, then you went on with the CT angio. When you had a negative D-dimer, let's say the D-dimer is less than 500, then we don't go on with the CT angio, because a negative D-dimer excludes pulmonary embolism in I don't know how many percent, but it's more than 95%. It's excluded. So if you have a less a value which is less than 500, then it's probably not pulmonary embolism. The PERC is not so precise as the D-dimer. So the more expensive the test goes, the more precise it is. But we always start with the least expensive and the least precise diagnostic measures. So these are the least precise. These are just information collecting. Then we go on with some more information collecting. Then we go on with some more hard laboratory values. And then we go on with some really hardcore expensive equipment. Okay? So, in general, just to include it in, I don't know, couple of sentences now. Pulmonary embolism patient, Wells criteria. Think of Wells criteria. Divide that into 3 parts: low, intermediate, high. Put the low patients below 2, put the high patients above 6 score. Everything in between 2 and 6 is intermediate. You always check the deep vein thrombosis, current and previously. If it's previous, then it's 1.5 point. If it's current, then it's 3 points. If you have more than 100 beats per minute, then it's 1.5 point. If it's an operation have been done in the last 4 weeks, then it's 1.5 point. If we have been laying down for more than 3 days, then it's 1.5 point. If he had a tumor, 1 point. If he has vomiting blood, it's 1 point. Remember that low, you go on with the least expensive. High, you go on with the most expensive. High, you go on with CT angio. Low, you go on with another criteria that I will mention in another video, PERC. Then if it's intermediate, then you go in with the lab value. It's a little bit more specific. If it's more than 500, then you go on the CT angio and so on. This is everything. Thank you very much for listening.